We declared a public health emergency of international concern. And when we do that, we do it because we see an event that's extraordinary, unusual, where we see international spread and where we want the world to come together in a coordinated way.
Yeah, right now, monkeypox is considered a global health emergency. It is the latest one. It's a rare designation from the World Health Organization. Last time we saw this was back in 2020. I'm sure you remember when COVID-19 first became a thing. Colorado has recorded 28 new monkeypox cases so far this month.
That's an average of more than one per day. Joining us now is 9 News reporter Jordan Chavez. Jordan, the latest numbers have some people in the LGBTQ plus community really taking precautions.
Yeah, this is really the community that we have seen have the biggest response so far to this outbreak, particularly when we are talking about men who have sex with other men. And that's really in large part because of messaging from the Centers for Disease Control and Prevention. Now, as of last week, the U.S. distributed 156,000 doses of the monkeypox vaccine to different states. And Colorado's health department says so far they have given more than 1,300 doses, but their supply is incredibly limited at this time. Now, because of that, Colorado has temporarily closed its vaccine request form. And right now, the vast majority of cases are spreading among men in the LGBTQ plus community, as we mentioned. But experts with the CDC do say it's incredibly important people outside the community as well stay very aware of this virus.
That's really important, as we know throughout history that infectious diseases don't stay in only one population.
This virus is now getting into family circumstances. It can spread to women and in close family contacts where there is a lot of hugging and kissing.
So epidemiologists with Colorado's health department say they are expecting more supply of vaccines from the federal government soon. And once they get more, they're going to push out as many doses and expand vaccine locations to try to make it as available as possible for people beyond the scope of the LGBTQ plus community.
So that's kind of my question is, if experts are saying this can affect anyone, then why are we really hearing about gay men?
Well, you know, this is in large part because of stigma, because of the messaging surrounding from the CDC. Why we're mostly hearing about that, unfortunately, you know, again, stigma, but right now it does appear to be that's the group with the highest exposure risk. But we do know that doesn't mean safety precautions only apply to them. Again, the numbers reflect the exposure risk. That doesn't necessarily mean it's who can be exposed to it, though.
Yeah, and I think the key is, while it's really rare right now, it could get worse, but the key is the messaging has been a mess on this.
Well, and I'm sure we remember from reports way back when during AIDS, this was kind of a similar thing that we're seeing now. Again, the difference here, of course, is with monkeypox, it's not fatal, so
right.
There is that difference. But specifically talking about the messaging, it's kind of similar there.
Yep. All right. Jordan, thanks for the update.